Hello doctors, welcome back. In this video lecture we will discuss the osteology of the upper limb. Student, the upper limb has 5 regions: the shoulder region, the arm region, and the forearm region, the wrist region, and the hand region. So we will discuss each region in detail later in this video. So student, moving toward the shoulder region. Student, the shoulder region has two bones, the clavicle bone and the scapula bone. These two bones combinedly form the shoulder girdle. Now student, first we will discuss the clavicle bone. Student, the clavicle bone is S-shaped bone. It is also called the collar bone and it is easily palpable bone. Student, the clavicle bone medially articulate with the sternum bone. This is the sternum bone, and laterally it articulate with the scapula bone. We will discuss the scapula bone later in this video. Student, the clavicle bone has two ends or two extremities. So here this is the sternal extremity or the medial extremity. Student, the medial extremity is a blunt shape and round shape, while the lateral extremity it is also called the acromial extremity, as it form articulation with the acromion process of the scapula. So the lateral extremity or the acromial extremity is a flat or a disc-like shape here, as you can see, while the medial extremity is a blunt and round shape. Now student, moving toward the another bone of the shoulder region, which is the scapula bone. Student, the scapula bone is triangular in shape here, as you can see, and it is a flat bone. Student, the scapula bone lies between the second rib and the seventh rib, and it is present on the dorsal surface of the body. This is the ventral surface of the body, while this is the dorsal surface of the body. Now student, moving toward the bony features of the scapula bone. So student, the scapula bone has three surfaces: the superior surface, and here this is the medial surface, and this is the lateral surface that lies laterally, and this lies medially, and it lies superiorly. Student, the medial surface is thin in relatively to the lateral surface, which is a thick and rough in shape. Student, the scapula also has three angles: the medial angle, the superior angle, and the inferior angle. Now student, moving toward the dorsal aspect. So at the dorsal surface we have a ridge that originates from medial and run toward the lateral of the scapula bone. This ridge is called the spine of the scapula. This is the spine of the scapula. Student, this ridge as run laterally, this form a process, and this is called the acromion process, and this acromion further form the articulation with the clavicle bone. Now student, the fossa which is present above the spine is called supraspinatus fossa, while the fossa which is present below the spine, this is called infraspinatus fossa. And student, here this notch, this is called the scapular notch. Now student, this upward and lateral projection, this is called the coracoid process. This process is called the coracoid process. Now student, moving toward the ventral aspect of the scapula bone. So on the ventral surface, this fossa is called the subscapularis fossa. Now student, this cavity, this is called the glenoid fossa. This is present on the superior lateral surface of the scapula bone. Now student, moving toward the arm region. So student, in the arm region we have the humerus bone. Student, the humerus bone is the largest bone and the longest bone of the upper limb. So student, the humerus bone has three parts: the upper extremity or the proximal extremity, the shaft, and the distal extremities. So first we will discuss the bony features in the proximal extremities. So at the proximal extremity we have the head, which is round shape, and this form articulation with the glenoid fossa of the scapula bone. No student, below to the head or distally to the head we have an anatomical neck. This region, this is called the anatomical neck. Now following the anatomical neck we have this large elevation, this is called the greater tubercle, and this small elevation, this is called the lesser tubercle, while the groove which is formed between the greater tubercle and the lesser tubercle is called intertubercular groove or the bicipital groove. Now student, inferiorly to the tubercles we have a constructed region, this is called the surgical neck. Student, the surgical neck is more prone to the injuries or fractures. Now student, moving toward the body of the humerus bone. So the bony features that are located in the body or the shaft of the humerus bone are the deltoid tuberosity. Student, the deltoid tuberosity is this rough elevation, while it also has this narrow groove which is called the radial groove. Here the radial nerve passes. Now student, the shaft of the body has also this narrow ridge. This narrow ridge is called the lateral supracondylar ridge, while at the medial side this ridge is called medial supracondylar ridge. Now student, moving toward the distal extremities of the humerus bone. So at the distal extremities we have the following bony features. This elevation here at the medial side is called medial epicondyle, while at the lateral side we have this rough elevation called the lateral epicondyle. This round process laterally, this is called the capitulum, and this is called the trochlea. So at the distal extremities we have three fossas: the coronoid fossa and the radial fossa, while on the posterior side this fossa is called the olecranon fossa. Now student, moving toward the forearm region. Student, the forearm region has two bones, the radius bone and the ulnar bone. Student, the radius bone is present on the lateral side of the forearm, while the ulnar bone is present on the medial side of the forearm. Student, first we will discuss the osteology of the radius bone. Student, the bony features of the radius bone are the head. This is the head, and which is followed by the neck. This region is called the neck. Inferiorly to the neck, here we have a rough elevation which is called the radial tuberosity. Now student, moving toward the shaft of the radius bone. So at the shaft of the radius bone on the medial side we have a narrow crest. As you can see, this narrow crest, this form the interosseous border, and this play important role in the attachment of the interosseous ligament. Now student, moving toward the distal extremities of the radius bone. Student, at the distal extremities of the radius bone, we have a notch. This notch is called the ulnar notch, and on the lateral side we have a process which is called the styloid process. Now student, moving toward the ulnar bone. Student, the ulnar bone has at the proximal extremities, it has the olecranon process. This is called the olecranon process. This process forms articulation with the olecranon fossa of the humerus bone. While this process here, this is called the coronoid process, and here it articulate are fixed into the olecranon fossa, while the notch which is formed by the olecranon process and the coronoid process is called the trochlear notch. Now student, inferiorly to the coronoid process, here we have a rough elevation which is called the ulnar tuberosity, while on the lateral side of the proximal extremities, this notch is called the radial notch. Here the head of the radius bone articulate. Now student, at the shaft of the ulnar bone, here we have again a narrow crust. This narrow crust is called the interosseous border. Now student, moving toward the distal extremities of the ulnar bone, so here we have a round head and a styloid process. Now student, moving toward the wrist region. Student, the wrist region has total 8 bones. These bones are called the carpal bones. Student, these bones are arranged in 2 rows, the proximal rows and the distal row. Student, the bones in the proximal rows are the scaphoid bone and the lunate bone and the triquetrum and the pisiform bone, while the bones, the carpal bones that form the distal row of the wrist region are the trapezium, trapezoid, capitate and the hamate bone. Student, you can learn the name of these bones by the mnemonic "She looks too pretty, try to catch her." Now student, moving toward the bones in the hand region. Student, in the hand region we have metacarpal bones and phalanges. Student, there are total 5 metacarpal bones which are named from the lateral side to the medial side as first, second, third, fourth and fifth metacarpal bone. Student, the bony features of the metacarpal bones are as proximally it has a round shape which is called the base, followed by shaft, and at the distal end this region is called the head. Student, all 5 metacarpal bone has same feature. Now student, moving toward the phalanges of the hand. Student, the phalanges of the hand form the digits as first, second, third, fourth and fifth are thumb, index finger, middle finger, ring finger and the little finger. Now student, the shape or the bony feature of the phalanges is same as metacarpal bone. The proximal part is called base, which is followed by shaft, and the distal part is called the head. Student, all 4 digits have 3 phalanges, while the thumb is made up of 2 phalanges. So there are total 14 phalanges in the human hand. Student, this was all about the osteology of the upper limb.